Hey everyone, so today I'm going to talk about whether statins cause heart problems. Now, before I go into this topic, I just want to say that I'm absolutely obsessed with cholesterol and I've gotten myself into a horrible rabbit hole. And I have so many more questions. I've read hundreds and thousands of articles about cholesterol, and I have so many questions that I don't have answers to, and there's so many gaps in the literature. So that's something that I just want to add as a disclaimer before I discuss my findings. Um, so I have mentioned before that LDL cholesterol is not a good marker for cardiovascular risk, and there's plenty of evidence um, for that, and I'm going to discuss some of that in this slide. So, before we go into that, I want to just say that there is very clear evidence that high cholesterol reduces your risk of death from any cause, where be it all cause mortality, be it cancer, heart disease, stroke, etc. Centenarians, people who have lived till 100 years of age or more, tend to have high cholesterols. So, this is very well known by doctors and scientists who are in the scientific community, and they call it the cholesterol paradox. It is very shocking to them that those who have low cholesterol tend to die younger. um, Personally, I'm not shocked. I'm not surprised by this because, from a physiological and evolutionary perspective, this makes a lot of sense. It's like saying, every cell in the body needs cholesterol. So, if people have more cholesterol in the body, if people have more of that essential nutrient in the body, it makes sense that they would live longer and have lower risk of death. And this is time and time again demonstrated in hundreds, thousands, and even millions of patients. So, if you see this graph in 12.8 million people, those who have a total cholesterol of below 200 have a much higher risk of death. And on the left, we have a graph, a U shaped curve. With those who are treated with statins. As you can see, the lower the cholesterol, the higher the risk of cancer in those with statins. And this is a study in around 41,000 patients. Um, so now I'm going to go into a few trials that destroy the theory that LDL cholesterol causes heart attacks. So, um, if LDL cholesterol causes heart attacks, then reduction of LDL cholesterol should reduce heart attacks, right? So we have tested this hypothesis with a lot of trials, and this is one research article that looks into a lot of trials with a drug called PSK9 inhibitor. This is a very potent LDL reducing drug. Okay, it is so potent that Mayo Clinic has advertised that this is a game changer in management of cholesterol. It reduces your LDL cholesterol so much by up to 75%. So, if a drug like this is present in the market that can reduce LDL cholesterol by 75%, then we should be virtually eliminating heart attacks with this drug. Okay, so let's see what actually happens in this study. So, this study has 81,700 patients, and we see a 19% reduction in heart attacks with the drug. Now, I want to talk a little bit about statistical manipulation and how pharmaceutical companies exaggerate the benefit of drugs using the relative risk versus absolute risk. Okay, so I looked at the data in this study, and I looked at the outcome rate. Okay, so in those who had the drug, 3.14% of patients had a heart attack, and in those without the drug, 4.05% had heart attack. So if you calculate the difference in risk, that's around 0.9%. But if you do something called relative risk, then that is around 20% risk reduction. And that's what the article has said. Then my next question is, if heart attacks is caused by LDL cholesterol, why did these patients who had such low levels of LDL cholesterol still have a heart attack? So, my answer to that is, from all my research, I've realized that heart attack is a multifactorial disease. Okay, it is caused by, predominantly, it is caused by insulin resistance, which means prediabetes, diabetes is the main risk factor for heart attack. And then there's also smoking and high blood pressure, chronic inflammation, etc. So, that is what I have mentioned before in my video as well. So let's look at the Jupiter trial. So the Jupiter trial is published in the New England Journal of Medicine, and it's a very famous trial that is, touted by cardiologists today. That this is the best trial that shows us how amazing statins are for reducing all sorts of cardiovascular events. Okay, so this trial, they reduced the LDL cholesterol by 50% from around 100 to 55. Okay, so if a cardiologist sees that your LDL level is being reduced from 100 to 55, they will be very, very happy with that. And another positive that the statin did is it reduced the CRP, which is an inflammatory marker, by around 37%. So this was advertised as, um, you know, reducing the risk of heart attacks and strokes by 44% in healthy people. And 44% is actually a very good number. So what did I do? I went and looked at the study, and I took the numbers and I calculated how much percent of patients on the statin had events and how much percent on the placebo had events. So those on the statin had 1.59% events, and those on the placebo had 2.82% events. I forgot to mention a few limitations of this study. So, like most studies, this study was funded by AstraZeneca. So, there is an inherent bias over there to begin with. And I am very skeptical about trials that are done by the pharmaceutical industry because they very easily manipulate the data. And not only that, in this case, they stopped the trial early. Stopping trials early when you see a positive result is something that the pharmaceutical companies do very, very often. So that way, we don't really know what the drug does over a long term. Okay, we just know short term that it's caused some sort of benefit. And here they've used statistical manipulation to exaggerate the benefits of the drugs. How do they do that? So, as I mentioned, the absolute risk reduction in events, including strokes and heart attacks, etc., is 1.2%. Okay. But they have used the statistical measure of relative risk reduction to exaggerate the benefits. So, yes, 1.6% is 43% less than 2.8%. And that is how they've advertised it. But in real life, it's only a 1.2% difference. Okay. And this is despite of this trial being funded by the industry. And here is another randomized controlled trial done in around 8,000 patients, where in half the patients they gave them 20 milligrams of a statin, and in the other half of the patient they gave 80 milligrams of high dose statin. So, most of the guidelines now say that we should give a high dose statins to people with heart attack and stroke. Okay. And this study has clearly shown almost no mortality benefit, none whatsoever, in the high dose statin group versus the low dose statin group. And I think these numbers are significant enough for us to start asking questions. Okay, 4,000 people, that is not a small number. Let's look at some more studies. Okay, here we're going to look at Rapatha, which is a very popular drug which is being sold by Amgen, a company that has sponsored this trial. So, this trial has said that this Rapatha drug reduces total cardiovascular incidence. Okay. Um, when scientists independently analyze this data, what they actually found is there's more deaths in the group that receive the drug. Okay. There's less deaths in placebo. In fact, There is more cardiac death in the drug group versus the placebo group. And when the scientists independently analyzed all of the raw data, they actually found that there was a 20% increase in risk of cardiovascular death in those who were given this drug. And by the way, this drug, it basically destroys your LDL cholesterol and brings it down to numbers like 20 and 30. Okay. So another thing what's interesting is that this trial was also terminated early, and I'm just wondering why. So there are some benefits to statins, and I cannot deny that. It has an anti-inflammatory effect and it has an anti-clotting effect, and we'll go into that in detail as well. So my question is, does giving statin on top of two anti um, coagulation drugs have much benefit? So normally patients who have a heart attack or a stroke, they're given an aspirin as well as a clopidogrel or some other platelet agent. Um, so if they're on three of these drugs which have an anti-clotting effect, will that increase the risk of bleeding? That is one of my questions. And my other proposition is, what if we treat the root cause of the problem, which is insulin resistance in most cases, right? And we can do that with multitude of interventions such as fasting, low carbohydrate, high healthy fat, adequate protein diet with good quality proteins, um, exposure to sunlight, addressing stress and emotional trauma, exercise, good sleep hygiene, and reduction of environmental toxins. What if we combine all of this and reduce the inflammation in the body? That is my question. Now, I also want to include bits of my clinical experience in this presentation because I've seen so many patients and I just cannot ignore the findings that I see in front of my eyes, right? So, let me talk about strokes. I've seen quite a few stroke patients. I see a lot of stroke patients in the emergency department. And it is well known in the literature that statins increase risk of bleeding, aka hemorrhagic stroke. Okay, I have seen patients with hemorrhagic stroke. Most of the patients who come with this bleeding, they usually get this bleeding because of a drug, okay, a blood thinner drug. But I have seen a lot of patients who come into the A&E with hemorrhagic stroke who are not on any aspirin or warfarin or any strong drugs, but they have statin on their medication list. And that is a finding I cannot ignore. Okay. Now, the question is, do statins cause heart failure? So, heart failure is one of the leading causes of death in the world, and so is dementia. Heart failure mortality is quite high. So, if you have been diagnosed with heart failure, around one third of people will die in 1 year. And it's really a horrible disease. It reduces your quality of life. You can't walk properly because you have breathlessness, you have fluid stuck in your lungs, you have chest tightness, you have chest pain, and there's no treatment for it. There's just symptomatic management, which then damages your kidneys, and it's quite a fatal disease. So, before I review the studies on statins and heart failure, I want to talk about statin myopathy. Okay. I've quickly gone through Google Scholar and seen hundreds and hundreds, maybe even thousands of studies talking about statin induced myopathy. This is well known in the literature, this is well known by the manufacturers. Statins damage every single muscle in the body. Okay. There is so much evidence about this that there have been guidelines that have been established. So the NHS has a pathway called the statin intolerance pathway, which talks about how to manage if someone is intolerant to statins. What if they get horrible muscle pains and fatigue and stuff like that on a statin? How do you manage that case? So to me, this doesn't make much sense because if you are depleting one of the most essential nutrients in the body and you are damaging every single muscle cell in the body, you cannot say someone is intolerant to that. That's not fair. If you're starving someone for many weeks and they feel tired, would you say that they're starvation intolerant? Does that make sense? And this, I want to go over what is the role of muscles in the body. I'm not talking about biceps and triceps and stuff, skeletal muscle, that is different. That also has a very important role in cardiovascular health, that has a very important role in preventing osteoporosis and fractures and falls and things like that. But I'm talking about smooth muscle cells. So, smooth muscle cells are present in every single blood vessel in the body, and these muscle cells basically release nitric oxide, okay, and they expand the blood vessel, something called vasodilation, okay, and that helps to improve the blood flow to any organ, including the heart. So if you are walking, if you are exercising, your blood vessels normally dilate, and that is because of the action of the smooth muscle cells, and they provide nitric oxide as well. And that's why we give nitrates to people with angina. And what happens if those muscles don't work properly? So we know that statins damage every single muscle cell in the body. So basically, you're not getting enough oxygen in the blood. And it's not just this one mechanism, it depletes something called CoQ10. So, CoQ10 is a very potential antioxidant that is needed by every single mitochondria in the body to produce ATP or energy. Okay, and if your cells are not getting enough energy, and if your muscles are dying, then you are going to have fatigue. Your muscles are not going to be able to pump properly. Okay, that's number one. Number two, vitamin K. Vitamin K is a fat soluble vitamin that removes calcium plaques from the arteries, thereby reducing your risk of heart attacks and strokes and things like that. Okay, so statins reduce cholesterol and they reduce LDL, so therefore they reduce vitamin K in the body and increase your risk of plaques. Another thing, statins cause diabetes. This is well established in the literature. Statin causes diabetes, and diabetes is the main thing that is a risk factor for heart attacks to begin with. So, this is a trial that assessed 420 people over 6 months. What is the effect of statins on skeletal muscle function? Um, Firstly, this is industry sponsored, so I'm skeptical about the data, but even they couldn't fudge the data. It's so clear that those who are above 55 had a huge reduction in the activity level after starting on a statin. And this has detrimental consequences for patients in real life. So now let's look at a study on 142 patients, statin associated cardiomyopathy. This doctor removed statins for many of his patients, and almost all the patients had improvement in their heart failure symptoms. Okay, improved fatigue, improved breathlessness, improved chest pain, and also improvement in muscle pain, memory loss, and peripheral neuropathy. So he stopped a statin for them. And how many of these people died 1 year after stopping a statin? Zero. And as I mentioned, heart failure is a dangerous condition. So around one third of people with heart failure die in 1 year. And obviously, when you take off the statin, your cholesterol increases. But as I've demonstrated, this is a good thing. And this is evidence that statins are actually associated with increased calcification of the coronary arteries on a CT angiogram. And that's to do with the vitamin K. Lots and lots and lots of evidence on how statins cause diabetes. So, I've already talked about how diabetes is the root cause of heart attacks, insulin resistance. So, diabetes and prediabetes. So, if statins are causing insulin resistance, are they really helping with heart attacks? Um, so there's a lot of literature on statins that have been published, and a lot of independent scientists have reviewed this literature. So this study looked at 192 trials. Those trials that have been funded by the industry are 20 times more likely to produce a positive result. which is why we need to be really skeptical, because there's a lot of mixed results here and a lot of things are not making much sense. Again, this is not just with statins, this is with so many medications and so many trials published by the pharmaceutical industry. For example, this is a trial done on antidepressants where seven trials were done in total, and only one out of seven showed a positive result. Okay, and guess what? What all results were published? Only the one was published, even though seven trials in total were done. There's so much more evidence. I mean, psychiatric drugs again. So 78% of the funded trials have positive results, whereas 48% of the independently done trials have positive results. So if only 48% of the trials that are independently done without bias have results, then that's really like tossing a coin. It's a 50-50% risk of whether a drug works or not. And that's my clinical experience as well. I've noticed some drugs work for some people sometimes, and many of them just don't, and many of them make things worse. So I'm next going to talk about statins and dementia. So thank you.